Hey, what's up YouTube? My name is Dr. David Song and we're going to take a look at the squat. So today we're going to look at advanced squat analysis. We're going to break down what to look for in the squat assessment, figure out strategies on how to get this person moving better, and basically just overall cleaning up the quality of your squat. We're going to look at the conventional squat today. We're not going to go into any advanced movements like the front squat, overhead squat, low bar, high bar squats. We're just going to do the conventional bodyweight squat. So I love using this as a screening tool in the clinic. It gives you a very good idea of how they're moving as a person, the different global segments are feeling tight or moving not optimally for that person. So let's take a look. Today's part one of the squat assessment. We're going to be looking at the hip shift, why it's happening. There's a ton of things that could be going on from the foot, the knee, the hip, even in the back that can be causing that shift to happen. So we're going to dig deep, look at the real issues. We don't do any guesswork here. We're going to get this person moving better and get to those results. A hip shift basically occurs when someone does their squat. You can see a notable shift to one side. So they'll shift all the way onto the one leg and it'll kind of look like this from the front. From the back, you can also notice some other things. On the back side, you'll also notice their hip hiking upwards on that side to accommodate that shift. You might also see some rotation through the foot on that same side. That's called a too many toes sign. So what happens is they're gaining external rotation of their toes like that, and as they come back up, it self-corrects, just like that. Okay. Now looking from the front again, you're also going to assess for whether or not this knee will go into a valgus knee position or a knock knees position as a shift to that side, just like that. With that, you may also notice internal rotation of the tibia and internal rotation of the femur. Okay, so you might notice something like that. Okay, so I'm exaggerating here, but you'll see this on some level in individuals that have a hip shift. Now, the reason why these signs are important is that it gives you a clue into what might be happening. So most people think that a hip shift just means like you're not activating the glutes, but it's actually more complex than that. We'll dig deep into that right now. So the number one thing we want to take a look at is we're going to actually start from the ground up, because if we could nip it on the bud starting from the foot, then maybe it's not a glute issue at all. Okay. So sometimes what you can get is overpronation of the medial longitudinal arch of your foot, which is basically that arch right here. Now this doesn't mean that you're flat-footed, but it means that your foot flans out even more and during the squat. Now some signs of that is that too many toe sign. So that's when the toes, in order to accommodate that arch, your foot to accommodate the arch collapsing, it'll push the bones out and it'll actually spread the toes into external rotation. So it'll look something like this. I'm going to do it on my right leg over here. It'll collapse and then you'll notice rotation through that foot, kind of like that. If that tends to be the case, you notice that the foot is rotating through while the rest of the leg is going into internal rotation. You want to assess the integrity of that person's medial longitudinal arch. So some things you can do is you can get that person to anchor the big toe into the floor or lift their big toe up to kind of cause that arch to lift up. And from there, if you're able to coach them to actually hold that arch up and get them to do the squat again, then and that corrects that hip shift, then you have your answer. It was a lack of their ability to hold their foot strong while they're doing a squat. Now we're also going to look at some of the other mechanics that can happen, namely all the stuff that can happen at the hips. Before we go into talking about the glutes, we're going to talk about your hip adductors here. What can sometimes be the case is that your hip adductors, which are your inner thigh and groin muscles, can be so tight that it actually pulls the rest of your pelvis to that leg while you're doing the squat. This can also happen if you don't have great control or eccentric loading of your hip adductors, which is the ability to keep these hip adductors as a knee stabilizer in a longer position. So that person might just feel more comfortable activating the hip adductors here, shifting to that side, because they don't have the comfort level of keeping their leg out here in a stretched position, eccentrically loading the hip adductors. That's a control issue. That's more of like you have to coach them how to activate these inner thigh muscles in long positions. So that's where you could do hip sliders on that other leg, get them to stretch it and load it and retest to see if that fixes their hip shift. The other reason, like a tight hip adductor, the only way to really rule that out is to get that muscle stretched out or do some foam rolling, or if you're a therapist, you do some soft tissue therapy, massage therapy. or myofascial release, or whatever you want to call it, on those inner thigh muscles, and then retest your squat, and if that fixes it, then boom, you have your answer. This can also be the case if you have really tight hip internal rotators, because as you can imagine, when you're actually shifting to that side, that right hip of yours is going to internal rotation relative to the other hip. Alright, so when that's happening, you want to ask them, how tight do you feel the front of your hip muscles or the TFL muscle right here? Okay, your internal rotators of the hip would be TFL, Gluteus Minimus, anterior fibers of Gluteus Medius. Okay, so all these muscles can be evolved. One of them can be evolved. You're going to ask them, do you feel hip pinching when you're doing that squat? Or do you feel them clicking whenever you're walking or something like that? You'll take a look. If those muscles are indeed really tight, they can be involved in causing internal rotation of that thigh. Lastly is the one that most people already know about, is the fact that they can't activate their glutes. Now, usually what I find it's not a strength issue, or it's more of a connection issue. Can that person connect with that muscle and utilize it as a tool during their squat? So some things that you can do to bring awareness to that glute is doing some neuroproprioceptive taps. You'll be tapping that glute muscle or the hip abductor muscle group and seeing if that stimulation alone is enough to align the squat back into the middle. Another thing you can do is wrap a band around the knees. What this will do is cause neuroreactive facilitation. You're forcing the brain to turn on the hip abductor muscles to keep your leg pushing out against that band that's going to be wrapped around your knees. Otherwise, that band will pull your knees inwards, so you're forcing them to activate it. So if you find that getting them to activate their glutes using the band corrects hip shift, then that tends to be the answer. It could just be that they're not engaging the glutes as much as you want them to be. Going up even higher, it can actually be a torso control issue. When the body feels like it's bending sideways and it doesn't really remember what center is, you will shift to that one side. One of the things you'll notice is with that hip shift, because the hip hikes, you'll also notice side bending of their back. These people tend to have really tight QLs on the same side or even on the opposite side, and also maybe sensitive SI joints, some pain or symptoms in the back here. So when they're getting some of that, a quick tip is try to see if they can bracing the core, pushing outward as if they're about to be punched, and then seeing if that helps to correct their hip shift. If it does, then there you have your answer. That they just need to engage the core a little bit more to prevent the hip from shifting during that movement. Going up even further, we're going to take a look at one of your largest muscles in the body that are responsible for spinal rotation, and that would be your latissimus dorsi muscle. So that muscle goes from the top of the iliac crest right up into the armpit to the front of your arm. And these people, if you can get them to engage their lats by bringing the elbows down and really getting them to flare their back, and if that fixes the hip shift, then you have the answer. The number one thing I find with those who have a latissimus dorsi engagement issues is that people tend to always feel it right here on the armpit, but you actually want to engage that muscle all the way down throughout the rest of the muscle belly. Because if you only feel it right here, you're likely just engaging your teres minor or teres major muscles instead of the entire lat. You want to make sure when they engage that lat that they actually can feel that muscle contract all the way down the side of their back there. Hey guys, so that pretty much sums up everything I wanted to talk about the squat and hip shift mechanics. So next time we'll go over some other things like butt winking. If you enjoyed this video, please hit subscribe and leave a comment down in the comments below. If you have any questions, I'll answer them ASAP. See you guys.